Hi, and welcome to the subject on head injuries. So we're going to talk about concussions, skull fractures, scalp wounds, and hemorrhage. Work your way through the sections. We've got our friend here. Say hi. Hi. So head injuries. Let's start with concussions. Concussion, obviously, there's a bit of an injury, usually with a forceful blow, can rock the head backwards and forwards, and as that brain hits the side of your skull, can cause lots of injuries, and you will get lots of signs and symptoms which you will read all about as you go through. Skull fractures is a really big subject, and obviously here is the skull. Any injury to that can cause a fracture, and then serious signs and symptoms, and they are going to need some serious help as well. Things that you might find is with a skull fracture is a boggy mass. So if you're looking at someone's head, you may find a boggy part. Don't start pushing down, because that could be where the skull's fractured and you'll be pressing onto the brain and causing more problems. So you may come across a boggy mass. Just remember that and let someone know as soon as possible. With skull fractures as well, you may get the bleeding from the ears, some clear fluid coming from the ears, maybe from the nose. You may also get some battle signs as well. So if we look behind the ears, you've got your mastoid process, and that can become very bruised, red, black, as the blood is basically coming from the skull and it's leaking out just underneath the surface of the skin. And you can also get big black eyes as well. So these are signs to look out for. Scalp wounds as well. When we talk about scalp wounds, there is a little video on there of me dressing a head injury, because they are quite difficult to do. But scalp wounds, the head is so vascular that any little cut or any little nick will bleed and bleed profusely. So we go to a lot of head injuries, and people are really shocked at the amount of blood that's come from them. But it's just so vascular, and a lot of times we look for the injury and it can just be a tiny little nick, but it's bled lots and lots and lots. So you can lose a lot of blood through your head. And then the other subject we're going to talk about is hemorrhage. And we're not talking about the little scalp wounds, we're actually talking about an internal bleed. So it'll be what's going on under here. So there's a bleed underneath the skull, underneath the bone, and that pressure will then push down and push down and push down on the brain. So if you have an internal bleed, it can just keep pushing down on that brain. And there's a little section here at the bottom of the brain, and it's basically trying to squeeze that brain out down the bottom. So they will go unconscious very quickly. They will have horrible headaches, and a lot of people say when they have a bleed on the brain, hemorrhage inside the skull, they say it's like a really bad headache, but it's almost like they've been hit round the head with a baseball bat and it's come on really quickly. So a headache that comes on really quickly is a really bad sign, and we need help straight away. So here's one I prepared earlier. We need to go through all the sections, have a little look, and work your way through. Any questions, you know where we are.